Can you tell me what a pelvic health physio does?
Yeah, so I'm a pelvic health physio, and it's our job to treat a range of conditions around the pelvis. So anything from bladder complaint, so it might be that someone's got stress incontinence where they leak on coughing, sneezing, laughing, running, jumping, so with stress or force. It might be that they have urge incontinence where they feel a strong urge to do a wee and leak on the way to the loo. Often people report that with latchkey. So as they're arriving home, they put the key in the door and they have to rush to the loo. So kind of bladder incontinence, urine incontinence, as well as emptying issues. So they might have difficulty emptying their bladder. They may feel there's still urine left. So anything bladder related. We also treat a lot of bowel conditions. So it might be that someone's got severe constipation. So we might be teaching them things like irrigation. Or it might be that they have issues with fecal incontinence, or again, urgency, so feeling like they can't hold or that they can't empty. We treat a lot of pelvic organ prolapse, which is where our pelvic organs, so it might be your bladder, your bowel, your womb, they drop down and come into the vagina. And it's not a harmful condition, but it's a condition that can frighten people quite a lot, and they can feel quite a lot of heaviness, which can make them feel quite distressed. So we treat that a lot and we get really good results. What else? We do quite a lot of postnatal rehab. So general rehab, which we recommend everyone has after having a baby, but also especially for those ladies who have something called rectus diastasis rectus abdominis muscles. So it's where their big six-pack muscles at the front don't fully return back, kind of they don't regain tension in that area. So we help with rehab of that area. And then just anything pain related. So they might have pelvic girdle pain in pregnancy, they may have back pain in pregnancy, they may have pain with sex, or just coccyx pain, any pain around this area.
And is it for men and women?
Yeah, we do. I do treat men. Not all pelvic health physios do, so you'd need to check. But I would say 3% of my caseload is men, just because these conditions are more common in women, because being female is probably the biggest risk factor for having these problems. So I do treat men again for issues with the bladder and the bowel, but also for erectile dysfunction or pain with sex and things like that.
What's the most common thing you'll see in your clinic room?
So recently, I do see a lot of pregnant ladies and people postpartum, because there is this awareness, and so people are seeking me out. But I actually see they're not the people I see the most. I see a lot of pelvic pain issues. I'm getting a lot through recently with coccydynia. A lot don't come to me directly. It's normally referral from a musculoskeletal physio, because they tend to be referred from orthopedic surgeons to the musculoskeletal physios, and then they will refer them on to me. And with the ones I've had recently, they've done really well. We get really good results, and often it's because of actual over-recruitment of pelvic floor muscles. I think there's a massive myth and misconception that doing pelvic floor squeezy exercises is the answer to everything, and it really is. And actually, often these people's muscles are over-recruited and working too much, and as a result become quite tight and stiff, and they're not travelling through full excursion, and that's why they're starting to get this dysfunction and this pain.
So with that coccydynia, is it relatively easy to treat or give tips for? Or
Yeah, it's not a case of lots of sessions. It's a handful of sessions normally, and usually by the time someone sees me, they've had the pain for a long time. It's just how it is with coccydynia, I find. They've usually had it for 6 months plus by the time they get to me. So there's that element as well. It's multifactorial because of that. But I had a male patient recently, 2 sessions, and his pain was fully gone.
Brilliant.
Which is amazing. So you do get the quick fix people as well. But yeah, it's very different treatment. It's down training the pelvic floor, it's stretching, it's releasing it, it's not lots of Kegels.
Great. So what can someone expect if they come and see you for a women's health assessment?
So it will start with questions. Perhaps I'm very used to asking these questions, but perhaps quite personal. So I will want to know why you've come, what your concerns are, what your goals are, and there will be questions around your bladder health, your bowel health, around sex, are you getting pain? So lots of questions around that, what exercise you do, what previous treatment you've had. Mm-hmm. And then with regards to ongoing assessment, I would want to look at your posture, alignment, how you're moving, the patterns of movement that you have. So the tests we use will vary depending on the person. Often checking of tummy muscles and the core system and how that's moving. And then it sometimes involves an internal assessment. It often does. It's not compulsory. If someone doesn't want that done, it doesn't matter. There's lots of other things we can do. So it's not essential, but it can give us quite a lot of information. So if someone's happy to have an internal examination, it's just a case of looking at, I want to look at the size of the vagina, I want to look for prolapse, so I get them to push down to see what their organ support is like. We don't use speculums like doctors often use when you have smear tests. Right. It's just insertion of one finger, and we want to check strength of pelvic floor, so we get you to squeeze your muscles. How long can you hold? Is it coordinated? I might have a little feel around the muscles gently to see if there's any tension or sore spots. Quick checks of sensation, but it's not something that's painful, or no one's ever really found it traumatic. It's not really a big deal. And then, like I said, I'd ideally like to assess in standing. Okay. As well after that. So just get you stood up and check the muscles in that position as well.
What sort of treatment do you as pelvic health physio offer?
So yeah, it varies hugely depending on the symptoms, the client, but yeah, I think with regards to the pelvic floor itself, I train it to travel through full excursion. So, and I train it to be very precise. I think a lot of people will come in to see me having, said, I've done my pelvic floor and it's just not worked. And I'll ask them what they've done, and they've, quite rightly, they've sat there and they've been on the app and they've done all their squeezing, and that's what they've been told to do, and that's fantastic, but that's not training their pelvic floor for its demand, first of all. So if they're having an issue, say, with running, doing your exercise in sitting isn't going to help. So if I need to run a marathon, I can't just sit here and straighten my leg up and down and expect myself to be able to run a marathon. So I suppose it's looking at the person and finding out what their demands are and making sure we're training them for that. And it might be that we start in sitting, but we need to be progressing to more advanced exercises for the exercise or the activity they need to be able to do. So yes, training for their demand. It's like I said, making sure that their pelvic floor is nice and bouncy and coordinated with the whole system. So that might involve some internal release and stretching and down training, which I often teach people to do themselves, a lot of breath work, and training the coordination, and making it precise, and to be honest, just training it in the same way you train an arm or a leg. But it's just not as simple as, if you've been doing pelvic floor exercises and your symptoms haven't gone, that doesn't mean you've done physio. Okay. So rather than going to a GP and saying, I've done loads of physio, I've done all my pelvic floor exercises, it's no better, and getting referred to a surgeon, see a physio, because it's not the same thing. If my job was just to give people pelvic floor squeezing exercises, I'd be bored out of my brain. So there's just a bit more to it. So it's making exercises meaningful, it's getting people back to lifting and weight training and impact exercises, and it's just it's a bit more advanced than just squeezing.
So does the pelvis and sort of surrounding area within it ever actually contribute to pain and injury or injury recovery elsewhere?
Yeah, absolutely. I see a lot of clients, usually again it is with my musculoskeletal colleagues, so we'll kind of share patients and rehab them together. Because if you're getting pain around the pelvis, around the hips, around the lower back, often there is a pelvic floor component, because the pelvic floor is the base of our core system. So it's one of the very important players within that. And often in these patients, we do find that it's dysfunctional, so it's not travelling through full excursion, or it's not coordinated, or it's not connected. Sometimes it's just there's a complete disconnect to that area, and I think it's not surprising because we're not ever taught about the pelvic floor. We're not, in schools, we're not educated on this. It's not until you have a baby that someone gives you a leaflet to do some squeezing of your pelvic floor. So it's not a surprise that and it's internal, so we don't see it, so we just don't think about it, but absolutely it's hugely involved within that. And I do find people tend to get a better result when we all work together as a team approach. We seem to get quite good results.
So if there's one piece of advice you could give to anybody, so any female, any male who may end up being a client in a pelvic health physio, what would it be?
It's got to be to prevent problems. Women, we just need to be taking this area a bit more seriously. We're different to men. We have a hole in our pelvic floor. Our pelvic fascia is much more stretchy because we deliver babies. Our urethra is shorter, and all these things mean that we're just much higher risk of bladder, bowel, prolapse, all these symptoms. We're living longer, which is fantastic, but we're a third of our life is postmenopausal if we're lucky. And it's not fun, leaking a bit when you run, not the end of the world, not being able to go out the house because of leaking and having to check where the toilets are, and it's just not fun, and it really makes people feel rubbish. So it's about prevention. So I suppose my advice would be to have a consult with a women's health physio. I'm getting more and more people coming through, young women who aren't pregnant, they haven't got any symptoms, but they just want to get an idea of where is their pelvic floor? Are they contracting this muscle? Am I doing it correctly? Am I strong? Am I coordinated? Because people just don't know. And I think they find it really useful just to be able to identify that area and incorporate it into their training and just learn really good habits and getting yourself in optimal movement patterns that are going to prevent problems in the future. So making sure that your core system is nice and balanced and nice and bouncy, to make sure that you're managing your pressure, so looking at the way you're lifting, the way you're moving, and getting people in these really optimal patterns that mean they're not going to be causing lots of downward pressure for 30 years. Make sure that, when you do a poo, you're not straining, you're doing it in a way that isn't causing downward pressure. Again, it's just getting in those good habits. The problem is we all, muscles that fire together, wire together. So a lot of what we do is just automatic. Yeah. And it's not until, we stop for a moment, have a look and just change these things to ensure we're looking at the long game, really. So prevent, see a women's health physio, know what your baseline is and know where you can build on it.
Amazing, thank you. So as a physio, if I wanted to get into pelvic health physio, what advice would you be able to give me?
I'd say brilliant, because we need more of us. We're still a relative rarity, and it's a growing area and it's a really exciting area, so I think fantastic. It is tricky. I think if you're already working in the NHS, then that's great, because it's just definitely the best place to learn. You get a huge volume of patients, you're supported by a big team, you are surrounded, you get a really good understanding of the whole process. I did 10 years in the NHS, and I'm so pleased that I did, because it's given me such an amazing grounding to build from. So I would recommend trying to, and there are jobs, it is possible, especially in London, And it might be that, you know, you do it for 6 months, a year, and you get that good grounding. Somewhere like King's, you're really surrounded by a whole team. You do weekly, you know, in-service trainings and CPDs. So you build really good networks. And it's because of that time as well that I now feel I have a really good network around me. You know, if a patient presents with issues, I know what urogynecologist to send them for this, that, whatever. And the people you trust and the people you think are good. And that comes from that. So ideally, get into the NHS if you can. It will probably mean that you have to take a bit of a pay cut and maybe align with that, but it will give you a really good grounding. If not, and you're working privately, I don't really think you can do it well on your own. There are courses you can do, but I think as well as the courses, you need to be finding a team that you can bounce ideas off, get involved with networks. So you are doing some regular training, and you can bounce ideas off someone and have someone that you can shadow and they can shadow you, really.